Improvements to my erectile dysfunction after prostate cancer. I am now 74, and over 9 years post-treatment. Vietnam veterans with prostate cancer are automatically presumed to have been exposed to Agent Orange and are entitled to VA benefits as I was. After treatment there was no information provided on restoring my penis and sex life, and I felt disconnected in many ways, in my relationship within my marriage. I did not know the importance of support groups, and I struggled to try to find my way in this new life. My wife Ellen was my support and my best nurse through this ordeal. We did not attempt to have sex in any way for about 2 years as my libido was nil and I was like a bear with a sore head. Not very approachable. My penis had shrunk and would no longer fill. Masturbation was very difficult as you have to have something to work with. As I began feeling better, I started trying everything I read about. Vacuum devices, electrostimulation, vacuum devices that also vibrated, compression rings, etc., but they all need something to work with. Some started working together, which gave me some hope. Viagra at that time was $200 for 12 tablets, so it was not something I could try as often as I felt I need to. It worked for some time, but unfortunately, 100 mg Viagra does nothing for me now, so I need something else. Fortunately for me, I worked for a medical firm before my diagnosis, for about a year, traveling to different medical offices, providing instructions and over 2,500 injections on prescription to men and couples wanting to try this therapy. Who would have thought that I would be one needing that same therapy? A good thing that I know how to inject the phallus. Fortunate for me, I had just read about a new procedure called the P-shot that could be used with another therapy, the focused wave treatment that I had just invested in. Focused wave therapy sends an energy pulse down and through my phallus and is painless. It causes minor damage to the tissues, resulting in new tissue needing to be built, but most importantly opening up blood pathways and regenerating new nerves. Following the treatment my phallus was swollen, not sore, but I could see immediately something good was likely happening. My wife noticed immediately that it was bigger. At the same time I was exploring just what a P-shot was and if an injection of PRP would be any use to me. I am not an athlete and I had read it was being used on them to assist healing from injuries. PRP is taken from your own blood, spun down, and then only the rich, bodybuilding plasma is extracted and used by putting it back into the area that needs rebuilding. Sounds fantastic. I must have been asleep at the wheel because it was being used the whole 10 years I was suffering and I didn't know of it. So the idea is to disturb the structure with the pulse wave, which then gets rebuilt better than before by the injection of PRP, platelet-rich plasma. I feel like a kid waiting on Christmas Day. The anticipation is great, but my body needs time to repair the damage done during the prostate cancer treatment, but I can see and feel change. Our sex lives have improved a lot. I'm not there yet, but I have something to really look forward to now. I can hardly wait through the 6 to 12 weeks to see appreciable change. Not back to pre-prostate cancer, but something to look forward to again and help to put my scales all back into place. The radiation treatment left me with lesions in my bladder that bleed from time to time into my pee. A penis that dribbles, and since I can't feel the wee. But I am learning ways to help control it better. I don't know when it is finished. I developed a workaround for it and try to only pee in my bathroom sink because it has a large, raised glass bowl. I can watch to see when it finally finishes. I try not to drink any fluids after 7:30 p.m. to reduce the number of times that I must get to use the toilet. Sometimes the flow is great and sometimes it starts and stops over several minutes. My bowel, because of the radiation burning, has lost its elasticity in places and leaks, making life somewhat difficult. Again, I have found a workaround and do not eat certain foods that want to pass too quickly through the system. All this and I am still alive and happy today. Looking forward to tomorrow. Ellen's journey is her story, but also one of finding your way and discovery, but fortunately for us, we were able to get there together. Thank you for watching. Ellen and Michael Moriarty, 2 RNs.